Good day, doctors. It's a great time to reach out to your patients and try to do some telemedicine, and you can do it with Rehab. And let's talk about how you can do a postural assessment and set somebody up on a rehab program using elastic resistance that you can quantify, grade, and document. So first of all, everybody understands postural assessment statically. And how you do that is you have your patient in athletic garb, make sure they're covered. All right, you can see I'm in athletic garb. You can see my postural anatomical checkpoints, my hips, my shoulders, my elbows, my knees, but I'm not scantily clad. It's electronic, make sure they're covered. So sportswear, but covered. Or make sure it's discreet. Next, it's a standard postural assessment, right? Have the patient stand with their feet, no shoes, hip width apart, relax their arms, have them close their eyes, shake it out, and just stand what they would consider their normal and do their assessment. Are the eyes level? Are the ears level? Shoulders level? Are they rotated? Is one arm tilted in? Is rotated into the other? That knee valgus, knee varus, pronation, all the usual things. Then have them stand from the side and have them just kind of shake it out and stand and assess them. How's that lateral plumb line? Ear over the shoulder, shoulder over the hip, hip over the just anterior to the knee, right? We look for all those things. If you're able to document those are your static findings. The next, if you have taken any of my seminars, you can do an overhead squat assessment where you can have the patient come up and do an overhead squat. A lot of the posture apps do this, but guess what? Now you become the posture app. So you can do an overhead squat assessment, checking those same anatomical checkpoints to see if they're maintaining alignment. And then also from the side, you can do that. Anybody who reads Dynamic Chiropractic, in 2019, I wrote a 4-series articles on the squat assessment. So if you haven't read them. If you need them, email me. I'll be happy to forward them to you. But they're right online and published in Dynamic Chiropractic. So you can do a static or a functional assessment. But let's make it easy. Let's say your patients have some upper cross dysfunction. Let's say they've been in a motor vehicle accident and they're having neck pain and back pain. Like say they're sitting at their makeshift desk and they're getting neck and back pain. If they have that anterior head carriage, forward head posture, tech neck, or Yonda's upper cross postural distortion, they're all the same. This is how you fix it with Rehab. Number 1, chest stretches. Any chest stretch. I like this one, standing in a door, or you can even use a TheraBand CLX band, all right, where you can have it behind, stretching you this way. So you tension up on it a little bit, and you have the arms go back, and they're stretching you back. Hook it up with a door anchor, and it's great, all right? Next exercise, cervical retractions. Cervical retractions. To stretch the suboccipital muscle, cervical retractions with cervical flexion. That'll stretch the suboccipital area. Anchor stretches. Now the TheraBand, you have to double it up to keep that shoulder anchored down. You can do anchor stretches for the trap, for the levator scap, for the anterior scalene, for the posterior scalene. Wow, I feel that one right over this eye. Boy, how long do you have them hold those stretches for? 20 to 40 seconds, depending on the age. The older the patient, the longer the stretch. How many reps? 3 to 5. All right, if it's a longer stretch, less reps. If it's a shorter stretch, more reps. So those are your simple stretches you can do. Now, we talked about quantifying this. I know for a fact that the TheraBand is quantified. The green band is, I think, 4.8 pounds. The blue band is 5.9 pounds. All right, the red band is 4.6, I think. So they're quantified. So that means at 100% stretch, going from here to here, you can quantify in your notes the patient was using this would be 5 pounds, 4.8, say 5 pounds, 5 pounds. If they double it, it's 10 pounds. All right, yes, you can say green stretch band, but if you do it with the green TheraBand, it's right on the box. The CLX says it right there, the exact amount of resistance. So you can quantify it, you can bill for it, and you can document it. Single green band, double green band, single blue band, double blue band, all right? And you can build up from there with all of the exercises. So what are the strengthening exercises that I'm going to ask you to consider for upper cross postural distortion, all right? Cervical retraction with an isometric load. Cervical retraction with an isometric load, okay? Now it's 5 pounds over here, 5 pounds over here. So that's 10 pounds. Hold for 10 seconds, a set of 10. Goal is to get the 3 sets of 10. For example, those are good goals. Maybe your patients can't do that. Brugger's phasic exercise for upper cross. Use the CLX. Now all they're going to need to dispense is a CLX and an anchor. And as they get good with green, you dispense them the blue. As they get good with blue, you dispense them the black. All right? They may end up in red the whole time, but you can quantify this, and it's represented and defensible. It's quantifiable. Every CLX, every TheraBand product is guaranteed to give you this resistance. So Brugger's phasic, open up, chest up, turn out. If they can do that by keeping the upper traps quiet, then they're able to extend and rotate up. Hold, 1, 2, and slowly recover. Extend, chest up, scapular retraction, depression, turn out, neck is quiet and relaxed, and really rotate those fingers up to get those scapular retractors engaged. Hold for about 4 seconds, and then slowly, 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 slowly come back. Brugger's phasic, can't go wrong. Another great exercise is just doing horizontal abduction. All right, I'm going to choke up on it a little bit and just pulling straight back and come over. Now, can I do both at the same time? Sure, I can do both at the same time. So I can engage them this way, and I can do them both at the same time. Progress them. 3 sets of 10 to 15 is what your goal is. When they can do 3 sets of 10 to 15 with this band, double it up. And they can do, that's tough. I got news for you. I'm working right now. 3 sets of 15 like that. Then we go to the next color. All right. Another great exercise, cheerleaders. Now when you do cheerleaders, palm up, palm down, almost like you're doing a median nerve flossing, okay? Almost like you're doing a median nerve flossing in every one of these exercises. Keep that cervical retraction going. Want to maintain that sagittal plane line. And you could just train sagittal plane line with your posture patients too. So these are all things you can work on. Now these are the exercises that I like. Another great one are standing angels instead of wall angels. The band's here, you pull out, and then you come down. Hold in between the shoulder blades as best you can, and then slowly come up. But really work on that. That's the key with what? With cervical retraction, okay? It's all about cervical retraction, all right? So these are all variations to work the back. With a door anchor, you can have them do seated rows, okay? Which is great. If you go to a heavier band, they can do single-handed rows. They can do a squat to row, all right? Those are all simple things. So what do I mean? I'm going to ask my assistant to hold on to the band here, right? Hold on to the band like I had a door anchor, and that's a row, right? It's a squat to row. Great back exercise, okay? And you can do a double row from here, just like I had a door anchor, all right? So these are all excellent exercises for the back. and you can let go. And for the upper cross activities, you can quantify it, you can document it, you can take static still pictures. Again, make sure the patient's properly clothed to have it in your records. Great way to work upper cross, telemedicine, postural correction. If you have any questions, reach out to me. I'm an email away or a phone call away. It's a great day to be with you and talk rehab and to reach out to your patients every day during this COVID crisis about tall, strong posture and active care. I'm Dr. Donald DeFabio. Have a good one.